session is brought to you by Jeevan Jala Sewa Samiti, a community initiative that seeks to support individuals and families through awareness, education, guidance, and meaningful conversations on issues that impact everyday life. It's our privilege to have Dr. Sunil Ninan with us today. Dr. Sunil is a senior consultant pediatrician trained at AIIMS, New Delhi, and holds an MRC PCH from London. With extensive clinical experience spanning several decades, he has worked closely with children, adolescents, young adults, and their families, helping them navigate a wide range of physical, emotional, and behavioral health challenges. Through his medical practice and interactions with young people, Dr. Sunil has gained valuable insights into the factors that influence decision-making, risk-taking behavior, and overall well-being during the formative years of life. Today's topic, the high that brings you low. A talk on smoking, alcohol, and substance abuse is one that affects individuals, families, educational institutions, workplaces, and society as a whole. We are grateful to have someone with Dr. Sunil's clinical experience and practical perspective to help us better understand this important issue. Please join me in warmly welcoming Dr. Sunil Ninan. Over to you, Dr. Sunil.
Greetings to all of you. Today, I am going to speak about a topic which I'm sure all of you will agree that is a very relevant topic. But some of you would be thinking, well, we all know that smoking is not good, or alcohol, or all of this is injurious to health. And so, why the need? Well, why the need for such a talk? And I would say the need for such a talk, we in JJSS, we felt that it's a increasing problem in our society. We need to address it. And in this age of social media, there are all kinds of information going here and there. So people need to hear what is something authoritative. For example, what does CDC, Center for Diseases Control, or WHO, or American Heart Association, what do they say about this? What are the medical things which you can really believe, or what is proven? So today, we are going to take a deep dive into this whole area of, number one, smoking, and also we'll talk about smoking weed, and we'll be talking about alcoholism. I won't be going too much into detail about intravenous drug abuse, but the principles and the main things are definitely going to be applicable to that also. What I am going to say, many of the psychiatrists know, all of the psychiatrists would know, and the psychologists would know. The rest of you, I'm sure it is going to be very useful. Even though you yourselves may not be into any of these habits, but you would certainly be having many friends or relatives who are into this. And even if you are into none of this, certainly we need to sensitize young people, teenagers about all of this. Prevention is better than cure. So let me start from here by giving you the data. WHO, World Health Organization data of the whole world. Tobacco kills more than 7 million people each year. Let that sink in. 7 million people. And not only that, see, those who smoke, it is bad for them. But second-hand smoke, earlier we used to call it passive smoking, that causes serious cardiovascular and respiratory diseases, including coronary heart disease and lung cancer, and it kills more than 1.6 million prematurely every year. So we are talking of huge numbers. What does the Indian data show? There's this publication, there's this group called the Global State of Tobacco Harm Reduction 2025 data that shows that the current prevalence of smoking among adults, as defined by, 15 and older for this purpose, in India, the current prevalence is 9.3%. So, kind of roughly 1 in 10 are involved in smoking. And that, because of the Indian population, it comes to around 10 crore individuals. And by the by, in general, people might think that smoking is coming down, but actually compared to 2020 data, which showed 8.1% prevalence, now it is 9.3% prevalence. What's happening? Now, there has been a study by Nasha Mukt Abhiyan. This is our Indian organization, government organization, under the Ministry of Social Justice. It says that 16 crore people consume alcohol in India. Please, for reference sake, the total population of India is 140 crore. Okay? Out of that, this 140, there are babies also. Okay? So, of course, they won't consume alcohol. So you can imagine this 16 crore is a big number. Now, out of this 16 crore, all are not like chronic alcoholics, but out of that 75% are suffering from alcohol dependence. And then comes cannabis. I will be talking in detail about this. Cannabis by 3.1 crore Indians. Opioids like heroin and all, an estimated 2.2 crores. And then IV drug abuse, thankfully it is much less, but still there are about 8.5 lakh IV drug users. Now we have to ask the question, why do people smoke? Because if at all there is one thing which is very clear in medicine, that is that smoking is injurious to health. Many things are not clear in the field of medicine, let me tell you. But this is very clear that smoking is injurious to health. Then why do people smoke? Well, tobacco contains nicotine. That's the culprit, main culprit. That nicotine actually, when it is smoked, it releases chemicals in our brain. So that makes the person feel good for that moment, and therefore they find it enjoyable. And once the person starts into this habit, it's very difficult to quit, because there is a craving which happens for nicotine. And then if you don't have it, you'll feel bad. And actually, I'm not encouraging smoking, but for the time being, smoking might make feel people relaxed and calm. And see, these people who smoke also are not complete fools, in the sense they are getting something actually, isn't it? Now we are going to examine whether what they are getting on one hand and what they are losing on one hand, what is the thing. But actually they might feel relaxed and calm for some time, or they might feel energized, or some of them will be able to focus more on the tasks. But there are adverse effects. What is the price that they are paying for, this, some relaxation, some energy, and some focus? Number one, it has been proven beyond doubt that there is an increased risk of cancers. It's not one cancer, but out of all the cancers, Lung cancer is the main thing for obvious reasons. The smoke goes into the lungs. But the risk of mouth cancer, oral cancer, throat cancer, esophageal cancer, stomach cancer, pancreas. Oh, I've written stomach twice. Okay. And also, the second major problem of smoking, chronic smoking, is chronic obstructive pulmonary disease. Well, pretty technical name for the problem which you would have seen in the smokers. That is, they have something called chronic bronchitis. They keep on coughing. It's a chronic cough. And some of them develop something else called emphysema. So they might develop, dyspnea, that is difficulty in breathing when they climb stairs and all of those things. And this keeps on increasing, and finally they might go into respiratory failure requiring oxygen. Not immediately. I mean, you don't smoke one day and next day you won't get this. But this chronic obstructive pulmonary disease is when people start smoking for maybe 15, 20 years. Now, I have to talk about risk. Let me tell you something very interesting. My uncle, many years back, he told me, Sunil, he told me about the name of a person, and he said, this particular person, he has smoked 20 to 30 cigarettes every day and for 30 years, and look at him, he has no problem. And at the same time, he told a second example. He told me the name of one Christian bishop, Marthoma Church bishop, who never smoked a single cigarette or bidi in his life and who developed lung cancer. So what is this? Well, if I was sitting in a room, I would have given time to you to answer this question. Where is the logical problem in what he's telling? Because what he's telling is fact, actually. In other words, what he's telling, a very chronic, heavy smoker, he is fine, and a person who never smoked has got lung cancer. Now, people who smoke cigarettes have 15 to 30 times more risk to contract or die from lung cancer compared to individuals who do not smoke. So how we have to understand this is, suppose there are 100 chronic smokers on one side and 100 non-smokers on the other side. What the scientists have found is not that all of these 100 people are going to develop lung cancer. No. The risk of this group of 100 chronic smokers for having cancer is 30 times or 15 to 30 times more than the other group. So in other words, there will be some people who smoke a lot and for whatever reason, they have not developed lung cancer. So there goes my uncle's argument number one. So it is possible for a person to smoke a lot and not have lung cancer. Next. Next is, lung cancer has many causes, out of which smoking is the main cause. Okay, so smoking, a person may not smoke and they can still have lung cancer because smoking is not the only cause of lung cancer. So I hope not just my uncle, but anyone of you who has that kind of thinking, this would clarify. Okay. So what is undeniable is people who smoke cigarettes have, I'm reiterating, 15 to 30 times more risk to contract or die from lung cancer. Next, cigarettes use remains a leading risk factor and it contributes to 80 to 90% of all lung cancer deaths, which means there will be 10 to 20% of lung cancers which are not due to smoking. Well, what are the other adverse effects of smoking? Number one, cancers. Number two, chronic obstructive pulmonary disease. Number three, coronary heart disease. That means, they are more susceptible to develop what in common parlance is called heart attack. Peripheral vascular disease. What does that mean? Our arteries, especially the larger arteries in the lower limbs and all, can be affected, and they walk for some time and they will have intense pain in the legs because of smoking. intermittent claudication is the medical term for that. They can develop something called Burgess disease. And then if a lady, when she's pregnant, she smokes, that's going to really affect the fetus. So this is a pictorial way of showing, on my left side, larynx cancer, esophageal cancer. Myocardial infarction is the medical name for heart attack. Atherosclerosis, deposition of cholesterol in the arteries, bladder cancer, oral cavity cancer, lung cancer. See, this chronic bronchitis and emphysema is what I said, chronic obstructive pulmonary disease. Peptic ulcer, acidity, and cancer pancreas. These are the common adverse effects of tobacco smoke. Well, we human beings are very innovative. So, smoking cigarettes and BDs is bad. So, shall we find a less harmful way of taking the same thing without the health adverse effects? So there comes e-cigarettes. We are in the age of email and everything e-commerce. So e-cigarettes. The other word is vape. Some of you senior guys, you may not be very familiar with this, but the youngsters, they know it. Okay, what is it? It's a battery operated device, and you can see that in the picture there. So there's no burning happening here. There's a liquid there, and that is heated, and that causes some aerosols to come, which they inhale. By the way, the designs, there can be slightly different designs, So this also contains nicotine, but some other harmful things are not there, So the claim is that e-cigarettes is fine. But what does American Heart Association say? Pretty authoritative, based on data. They say that while it's true that e-cigarette aerosol doesn't contain all the contaminants in tobacco smoke, it still isn't safe. Hello. It still isn't safe. Why? You see, most e-cigarettes deliver nicotine. So nicotine is there, and that is highly addictive. So people cannot have e-cigarette once or twice, they can get addicted. They also, this vapor contains some harmful substance like diacetyl, and that is linked to serious lung disease, some cancer-causing chemicals, some heavy metals can also be released, like nickel, tin, and lead. And not only that, e-cigarettes have been linked to thousands of cases of serious lung injury. Sometimes it has resulted in death. So the CDC, what is CDC? Center for Diseases Control in US, which is, they kind of gave policy statements on many important issues, diseases. So they recommend that people should not use e-cigarettes. Now, cigarettes are basically cigarettes, and I'm talking cigarettes. The same is applicable to BD also, please. Now, I talked about vaping. So people said, well, let's use smokeless tobacco. So in India, especially in rural India, people chew tobacco. They sometimes sniff in the nose. Or, when I was in the Madhya Pradesh and Delhi, they would do like this. They would take khaini, they say khaini, and then they will do like this, and then they will take like this. They will put in the mouth between the cheek and the gum. So this is a pretty common practice. And the problem? Because this practice is not very common in the rest of the world, by the way. Are you seeing this? On the tongue, below the tongue, there's an ulcer, there's some small swelling there. This is not the only way, but this is one form of oral cancer. So there can be cancer of the tongue, cancer of the cheek. And oral cancer is the most common cancer in Indian men among all the cancers: lung cancer, liver cancer, brain tumor, blood cancer. Oral cancer is the most common cancer in Indian men. Why? Because of this pan chewing, or tobacco chewing. And this is the third most common among women. Oh my God. So some of you are saying, well, where? Oh, because you have not been to rural India, where many women chew tobacco. And this accounts for roughly a third of the global burden. Among the whole world, 1/3 is in India, this oral cancer. So India records 1 lakh new cases annually. And do you know what's the treatment for oral cancer? You have to take out that part. In my MBBS days, I used to see in surgery, Department of Surgery Unit 2 in AIMS. They used to do all this. There will be people whose this much part is taken out. All kinds of, the face itself is deformed after the surgery. But then that has to be done, otherwise they will die. And that's the thing about oral cancer. You see? Over 95% of oral cancers in India are directly linked to the use of tobacco and areca nut, supadi, areca nut products. And when you use both of this, that creates a severe risk. So let me show you this one. Many of you would have seen the advertisement of Vimal, Bolo Zuma Kesari. And you see 3 prominent Hindi movie stars advertising it. Well, that is Vimal Pan Masala. So that's a very common thing again in North India and also in South India, but especially in North India. So what is Pan Masala? Well, Pan Masala specifically by definition should not contain tobacco, but gutka contains tobacco. So Vimal Pan Masala, whether it contains tobacco or not, depends on the specific variant. Why did I say Vimal? Is not that I have anything, only this is not the only name. There are n number of names under which Pan Masala and gutka is sold. But this is more common, and any one of you who watches any program in the TV or YouTube, many times we see advertisements of this. And at this time, let me tell you about something called surrogate advertising. You see, when things are very clear that something is very harmful, by law, you are not supposed to advertise. By law, you cannot advertise liquor. But so Kingfisher, they will not say premium or bagpiper or McDowell. You know what they will do? They will advertise McDowell soda or Kingfisher premium or whatever water or whatever, anything, but it is called surrogate advertising, so that those who consume that, they would be reminded of that. Oh, this is there. It's so sad actually that people do surrogate advertising, and the government should really not allow surrogate advertising. So let me move forward. World Health Organization data, it says that over 60% of the smokers, they said that they wanted to quit. What does this data show? This data shows that many of whom are into tobacco smoking, they actually want to quit. But they can be successful only when there is counseling and some kind of medication and all that will help them. Now, this is a slide which I would like you to see. The font is a little small. But 20 minutes after a person stops smoking, the heart rate decreases and returns to normal. Okay? 12 hours later, the carbon monoxide levels will return to normal. 24 hours later, lung will clear out the tobacco debris of that smoke at least. 48 hours later, sense of taste and smell begin to improve. But this slide I have put basically to look at that 1 year thing. If a chronic smoker stops smoking, after 1 year, their risk of heart attack is halved, which means it won't go away, but it can become half. So there are two messages in that data. Good to stop smoking even though a person has smoked for 20 years, at least their risk will become half after 1 year. But the other point to be noted is, if you have been a chronic smoker, even if you stop smoking, still the risk will be reduced only by half. Look at this. After 10 years only, the risk of stroke and cancer decreases. So it's not that a smoker smoked for 25 years, now he has stopped. I remember a funny thing. We used to have a very flamboyant professor in AIMS called Professor A.N. Malviya. So he was teaching us, how to ask the patients regarding history of smoking. If you ask some people saying, okay, so are you a smoker? They will say no. Actually, technically, they are right, because last 1 week they have stopped smoking ever since they spit out blood from their cough in their phlegm. So the way to ask them is, okay, so when have you stopped smoking? Because this stopping smoking for 5 days and 1 week is not going to help. That is why it is better not to start this at all. Because even look at this, 15 years it will take for the risk of cardiovascular diseases to become same as that of a non-smoker. 15 years after quitting. Let me move on. Well, somebody says, uncle, I don't smoke tobacco, but weed I heard is not very harmful. It won't cause lung cancer and everything, and in fact it gives me a kick. Well, some of you more senior guys, some of you are saying, what is weed? Well, weed is cannabis. The other name for cannabis is marijuana. It is also called by other names like pot and grass. Okay, the local names for all of this. Okay, bhang and everything. Now, this picture is that of the plant. And, tetrahydrocannabinol is the main chemical. Okay, and that can make people feel high. Actually, marijuana has medical uses also, especially in chronic pain, muscle spasticity, some kind of epilepsies and all. But most of marijuana in the world is used for recreational use, basically for people to get high. Marijuana can be smoked, it can be inhaled, it can be taken by mouth, rubbed into skin, mixed into food and beverages. So there are various ways of taking this. What is this California business? In the year 2022, we as a family, we visited US to be with our relatives. I was stunned to see a huge billboard, if I remember right, it was somewhere in San Francisco, saying, marijuana delivered at your doorstep. It's almost like Swiggy, Zomato. Okay, you order marijuana, you get it at home. I was stunned. So, this is the situation. Well, are there any adverse effects of marijuana or weed? So this is an article published in PubMed, 2024 article by Mark Chandy et al. Now what they say is, weed is not harmless. There can be cardiovascular effects like increased heart attack, arrhythmia, rhythm issues, cardiomyopathy, etc. There can be problems in lung like chronic obstructive pulmonary disease, lung fibrosis, pulmonary hypertension, which means the pressure inside the lung arteries is high. This can also cause neuropsychiatric problems, like can cause increased sedation, or person may not like to really move around much. So that's why people who are in weed, paradoxically, they feel high, but they are like this, And it can cause impaired motor coordination and judgments. I'll come to that when I talk about alcohol. And it can also increase the risk for cancer. It can decrease fertility, which means the chance of having children. Approximately 10 to 30% of people who use cannabis will develop cannabis use disorder. What's the meaning of that? That means they will become dependent. Please note this number, 10 to 30%. Because there are many people who think, weed, no problem, I won't be addicted. No, there is 10 to 30% chance that if you use weed, you will become dependent. And this is that's name of the disorder is called cannabis use disorder. Now, if the people use weed daily, then this risk increases up to 50% chance that they will develop, something called addiction and tolerance. Again, I will come to that when I talk about alcohol. Now, this risk of, becoming addicted is much more higher for teenagers. If they start at the teenage, if they start having weed, then their risk is 4 to 7 times higher. Now, let me talk about something called slippery slope. See, in almost all of these substance abuse things like, tobacco or alcohol or weed, people say, I'm in control. It's okay. A little. That's fine. 1 peg, 2 peg. That's okay. Now, what people don't realize is the weakness of human nature. I'm sure all of you would say that we are weak, actually speaking. We may not be weak in all the areas, but we have our own weak areas. And in those weak areas, we can slip. So a person who is weak in some of these areas, they may start with weed, but they will not stop there. They will go into something which will give them more kick. Or to get the same kick, they will have to use more amount. So that's the whole thing about slippery slope. It's a slippery slope. And whenever there is a slippery slope, walk cautiously, and the best is not to go in that area at all. Now let's talk about alcohol. Well, those of you who are not into drinking alcohol, some of you may not even know what a peg means, Chota peg, bada peg, 30 ml of hard liquor, small peg, large peg 60 ml. Again, locally people may use it in a different way. Generally, this is the thing. Now, what is the percentage alcohol in many of the things that people consume? So, beer. By the way, some people talk of beer as if, it is beer, nothing. No, beer has 5 to 10% alcohol by volume. So, if a person consumes enough beer, they can get intoxicated. And then beer on a regular basis, they can get something called beer belly and various other things. Okay, so beer. Then wine. So again, there are different kinds of wines. That's why this range. Okay, so there can be wine which has less percentage of alcohol. There can be stronger wines, and then comes whiskey, rum, brandy, etc. And that has 40 to 50% alcohol. Now, let's talk about the adverse effects of alcohol. As a doctor, let me tell you, alcohol has increased cancer risk. Cancer risk, that is, which cancers? Think of the from where alcohol goes. From the mouth, it goes to throat, esophagus, goes to intestine, goes to liver. There is increased cancer risk. I would say the most important problem which alcohol causes over a period of time is damage to the liver. And the medical language for that is cirrhosis. Nodules appear in the liver and they get fibrosed, and later on the liver failure can happen. Then a regular alcohol intake can cause cardiovascular complications like hypertension, cardiomyopathy, etc. Well, once in a while in Twitter and or social media, you will find, oh, there's a study which shows 1 peg every day is good for health and all of these things. So but you see, they are of some anecdotal, some study here, some study here, but overall it is very, very clear that alcohol has adverse health effects. Over a period of time, if alcohol is taken regularly, it can cause damage to the brain. It can cause cognitive decline. That means the intelligence, memory, those can be affected. Then alcohol can cause gastrointestinal issues like acidity, peptic ulcer, and all of those things. It can weaken our immune system. Well, it refuses to. And then the most important problem is once people get hooked onto it, they can become dependent on alcohol. In other words, when they try to come out of it, they have withdrawal symptoms. It can cause anxiety. It can cause depression. But now let me come to something very, very, very important. As far as I'm concerned, the biggest problem with alcohol is not the medical problem that it causes. Some of you say, what? Dr. Sunil? Alcohol causes. The biggest problem with alcohol consumption, you know what? This to me is the problem with alcohol. While alcohol can give some kick, agreed. Some, some people, when they are fearful or they will take it to overcome little fear, to feel more confident, etc. But what happens is the person loses his or her sense of judgment. One of the things which makes humans human is that they know what to do when, what to say, what not to say. That sense of judgment can go. For example, I am in a drawing room of my friend, there are a few people, we are talking. Suddenly I feel like passing urine. Okay? Now a normal person, what they would do? They would go to the washroom. But if a person is under the influence of alcohol, they might pass urine anyway. Or, to give another example, suppose I get very angry with my friend for some reason. No. If I am sober, I would know how to handle that anger. But when I am not sober, what can happen is maybe there's a sharp instrument there. I might hit him with that. I can do anything. Or maybe, just one more example. A person sees a beautiful woman. Even though he may like to hug her or give her a kiss, but he knows that's not his wife. So he won't do that. But a person who is under the influence of alcohol can end up doing anything. So this is one of the main problems of alcohol. it can affect the sense of judgment. And so what happens, these people get into they drink and they come home and they get angry with their spouse or children, they break things, and I don't have to describe this. Some of these things are deep in my heart, because when I grew up, beside our home was a family from Uttarakhand in Madhya Pradesh. We were staying in Madhya Pradesh, but these people were from Uttarakhand. Very wonderful family. And that uncle was very, I would say, a palm person, a nice man. But he was an alcoholic. And I could see scenes of that when he would drink, and then somewhere he would lie on the road, and then some people would carry him, and then sometimes he comes and vomits, and then the whole scene at home, his wife is just standing there, children are like this, and then he comes to his senses next day, and then he is fine. He's a nice man. Oof. It's so sad to see human beings made in the image of God doing such things under the influence of alcohol. And so a person under the influence of alcohol can pick up fight with others and go to any extent. And road traffic accidents, many of the road traffic accidents, when a person is driving, especially in India, how much careful we have to be. Anything can happen. We have to be so careful. But alcohol will impair that whole ability to sense things. Can result in road traffic accidents, can lead to decreased productivity at work. And then poverty. Do you know alcoholism is one of the major causes of poverty in India? And sometimes there's this man who gets into alcohol, and they'll keep spending, and they'll finally become very poor. So there are these two words which we must understand, and this is applicable not only to alcohol, it's applicable to drugs also. The first is the whole thing about tolerance. Okay, you take alcohol or drugs, initially that will cause a certain amount of kick. That's why people take, isn't it? But over a period of time, because something happens in the body and the metabolism, that then people will need more amount of alcohol for the same level of intoxication or kick. And this keeps on increasing. And after some time, they will go into something more stronger. And that's how people get into higher forms of drugs. And ultimately, people go into IV drug abuse. See, those who go into intravenous drug abuse, they don't start off like that usually. After some time, many of these things stop giving that kick, and they still want it. So, tolerance. And the next important point is withdrawal. So, after some time, people say, no, I want to get out of it. But they try to get out of it, they have withdrawal symptoms. So they then have to take it to just be normal. So initially, people who started taking alcohol or drugs for a kick end up taking alcohol or drugs just to survive. And that is why I am hating alcohol and I am hating drugs, because they just destroy a person actually. And I mean, you would have known so many people, even personally, maybe in your families or your friend circle, who have gotten into these problems. And so there are people who finally say, okay, I'll stop my drinking. But tomorrow. Now, to those who are hearing now and those who will hear me through the YouTube video which we are going to upload, anyone who says that they will come out of any habit tomorrow, I would say are not serious. They will not be able to get out of anything tomorrow. It is today. Today is the day of salvation. Today is the day of deliverance. There has to be a decisive thing. But it is that self thing is required, but that's not enough. If people have to say no to alcohol, people have to say no to drugs, they would need help from medical people. I have included psychologists and counselors as, I mean, they're also part of medical. When I say medical people, means doctors, psychiatrists, then psychologists and counselors. Number 3, either a spouse or close friends, relatives, such people need encouragement. You see, this is where I would like to say that most of the people, when they look at people who are suffering from, alcohol dependence or they are into drugs, there is a certain kind of condemnation with which, people look at such people. And but what such people need is not condemnation from you. What they need is support from you. They need support, because maybe initially you yourself told them, don't get into this, and they didn't obey you, or they didn't agree with you. They went on their own and they got into this hole, okay, this pit. But now that they are in this pit, now there is no point of condemning them. Now what they need is a helping hand. Of course, there are organizations. I'm so happy, especially when I'm in Bangalore, I see so many organizations which are there to help people come out of this, So we need help. They need help. They need encouragement, not further putting down from them. See, I told you, I had told you, you had told. That's over. Now, let us support, let us help, But you need help from medical people, psychologists, counselors, spouse, friend, relatives. Well, I have not told you the main person. You need help from God, you see. The Almighty God, who is the deliverer, I must say, okay. So let me move on. The freedom to live without alcohol is worth fighting for. See, it is not easy. Once a person is into alcohol dependent, or see, actually the same thing applies to smoking. It is not easy, because that craving can come. And so it's a fight. But this fight is worth fighting for. Because if people win, they get a freedom which they won't have if they are under this addiction of alcohol or smoking or drugs. Now let me talk to you about an organization called Alcoholics Anonymous. Well, many of you would have heard something called Alcoholics Anonymous. But as I read up about this, I was so excited, I'll tell you something very, very interesting about them. I'm not here to promote any particular organization, but some of the principles are excellent. Alcoholics Anonymous actually was founded in 1935, maybe around 90 years back, by Bill Wilson and Dr. Robert in Ohio, United States. Many of you would not have heard their name because they all want to remain anonymous. You see, that's the thing. Now, there's something called a Cochrane review. Now, for those who are not from medical fraternity, let me tell you what Cochrane review is. You see, there are all kinds of studies which happen all over the world on so many medical topics. How do you assess that? How do you analyze that? So there is this Cochrane database. So what they do is they take up on a particular topic, if there are so many different studies, they do a review and they find how powerful is that study, whether that study was done well or not, what was the result of that study, and they compare. They do something called, those who in statistics, you would know there's something called meta-analysis. So a 2020 Cochrane review of Alcoholics Anonymous, it showed that those who participated in Alcoholics Anonymous, they remained abstinent from alcohol for longer periods of time than, there are there's cognitive behavior therapy, motivational enhancement, and all of those things, you see. It's not that those things are not good, but Alcoholics Anonymous they perform better. They have shown better results. Wow. Now, what is Alcoholics Anonymous? It's a fellowship of people who come together to solve their drinking problem. They're very focused. So they don't come and discuss about Trump or West Asia war or the rising fuel prices. No, they come with a particular thing, to solve their drinking problem. There's no cost to attending that meetings. There's no age bar. There's no education requirements to participate. Membership is open to anyone who wants to do something about their drinking problem. And its primary purpose is to help alcoholics to achieve sobriety. Very, very interesting. And you would ask, well, is there Alcoholics Anonymous in India? Yes, especially in cities. But then they are anonymous. There are no big banners there, so you won't find it. But there are these groups of people. Very interesting. If you can, of course, go and find out from the web about more about Alcoholics Anonymous. But I want to focus on something called 12 steps of Alcoholic Anonymous. So these people, they have a standardized thing. So there are these 12 steps of Alcoholic Anonymous. And excellent, let me tell you, they are excellent steps. Do you know that these 12 steps are not only followed for coming out of alcohol, these 12 steps are followed by many for coming out of overeating, for any kind of thing, addiction. Many people use these principles. What is the first principle? They say, we admitted that we were powerless over alcohol, that our lives had become unmanageable. Wow. The first point, let me add, to overcoming any problem is to acknowledge that we have a problem. You see, one of the problems with many of the alcoholics is they won't admit that they have a problem. They say, no, I am fully in control. I have no problem. Once in a while I have some social drinking. That is all. Yeah, okay. If you don't admit that there is a problem, you cannot overcome that problem. I would say this would apply to even coming out of pornography or any other things. Next, second, came to believe that a power greater than ourselves could restore us to sanity. Wow. That means it's good to admit that there's a problem. But who can help us? Person has to believe that a power greater than ourselves could restore us to sanity. Well, Alcoholics Anonymous was started by people who had Christian faith, but it is not limited to people who are Christian. That's why the word written is power greater than ourselves. You see, could restore us to sanity. Now, people have admitted, they believe that they cannot come out of it by themselves. They need a higher power. But third point, they have to make a decision. No, that's also important. Many times there are these men who are alcoholics, their wives are making decision. It's not enough for the wife or the father of a teenage boy to make a decision that they should come out. They have to make a decision to turn their will and their lives over to the care of God as we understood Him. Next, they were encouraged, all these people are encouraged to make a searching and fearless moral inventory of themselves. So those who are into alcoholism will not have problem of only alcoholism. They may have other problems also. What is it? Just find out where you are. Next. So one day admitted that they have a problem. But then they are admitting to God, to themselves, and to another human being the exact nature of our wrongs. See, many times people are willing to admit to a higher power that there's something wrong with them, but they won't admit to any other human being that there is a problem with them. You see, so they will blame somebody. They will say, I had a bad father, you see, I had a difficult childhood, I was abused. Okay. But there's nothing wrong with that person. You see, if they are not admitting anything, they cannot come out of anything. You see. Next, they were entirely ready to have God remove all these defects of character. So, I think the Alcoholic Anonymous people had an understanding that alcoholism is not a single problem standing apart from all other problems. There are other problems related to this. There may be people with frustration, depression, or other problems, or, So they are ready for a complete overhaul. Seventh, now a person may be admitting they may be ready, but they have to humble themselves and ask him to remove shortcomings. You see, one of the biggest problem of human being, including person like me, is to not only admit that I have a problem, but to ask help. Because asking help means actually a proud person cannot ask. You see, we have to humble ourselves. Number 8. These members are encouraged to make a list of all persons they had harmed. Oh, so there's an acknowledgement that it's not just a personal issue. Imagine if I am an alcoholic and I come, I shout, I break things, I squander money, I beat up my wife. You see, my children therefore are not able to go to school. Well, there are many people who are harmed in this process. Make a list. And making a list, not. Alcoholics Anonymous, they said they will make direct amends to such people wherever possible. Sometimes it's not possible. They will make direct amends to such people. And by the way, this is not that there's one meeting in which all these 12 steps are told and everything is fine. No, this is a process. They keep meeting, encouraging one another, confessing their problems. So some people advising, it's people help each other. So there's a continuation, continue to take personal inventory. And sometimes, people take baby steps and then they fall. So they need that help. And then they would use prayer and meditation to improve our conscious contact with God as we understood Him. So there is some kind of a discipline, spiritual discipline of prayer and meditation. Wow. And finally, this Alcoholics Anonymous, the 12th step is that they carry this message to other alcoholics. They not only are helping themselves, but they are helping other alcoholics to come out of this problem. Why did I share all these 12 points in detail? First of all, I found it excellent. They are the way of coming out, I would say. The very, very important principles at the risk of you all feeling, why are you telling this again and again? The first step is admitting that there is a problem and believing that we cannot do it ourselves. We need a higher power, help, God's help, and making a decision and willing to look at yourselves and the exact nature of your wrongs, and then ready, making yourself surrender to God and making yourself ready to, change, asking God to help, make a list of all persons harm and make direct amends to them, and it's a process. It's not a one-day thing. And then spiritual disciplines of prayer, meditation, and then helping others to come out of it. Wow. So as I told you earlier, it's applicable not only to alcoholics, but drug addicts and maybe smoking, you want to come out of that, or any other similar problems. There are medical things, people for alcohol de-addiction, there are things which can be done by doctors. I'm not going into that. There are organizations which can help you. There are psychiatrists who can help you. In tobacco chewing, this is by a product by Cipla called Nicotex, nicotine gum. The advantage of this is, this also has nicotine only. It's just that it's not smoke, there are not additional problems, so it's a kind of a step down, not a sudden stop. People are not able to stop. They can start having this and then come out of it. So this is another way of doing this thing. So they're available over the counter. It can be bought. So this brings me to the end of my presentation. Not that this is all that can be spoken about substance abuse. I have not gone into IV drug abuse. Oh my God, I cannot even imagine the problems with intravenous drug abuse. It is, drug overdose. You see, many times happens. As I told you, 2022 when we went to US, we also visited LA, Beverly Hills, Hollywood. And as we were taken through the tour, we heard things like, there was this person who was saying, now we are passing through this famous actor's place, and, this person died of drug overdose. All kinds of things happen. And the best thing I can tell, especially to teenagers, young people, is it's best not to go into it. If you notice, many of these problems start early. One is broken homes, fathers and mothers not doing good parenting. This all can, start off this. But especially in teenager age group, people want to prove themselves that I am also a man, or nowadays girls are also heavily into this. They want to say that they are cool people, and and just to show that they are cool, they would start off. Many of them are not starting off thinking that I want to become an alcoholic, I want to become a drug addict. Nobody is thinking of becoming any of this. They start off like this, but then they get into this slippery slope, they fall, and then they find it difficult to come out. So my message, and it's not some unique message which I am telling, this is the message which the government wants to give, which NGOs want to give, who are involved in all of these areas, is don't get into it at all. Why taste? Why do this when you very well know the consequences? No, I will just taste and come back. Well, it's like saying I will touch the main switch, and then I want to know what current, I want to just understand how does it feel like being electrocuted, I want to know. You can know. It's a risky thing. Okay, thank you. And to those of you who are hearing me today in this Zoom meeting, I want to say, and those of you who will hear me through YouTube, you may not be a drug addict, you may not have problem of alcohol, but please do forward this talk to college going students, to youngsters, to your friends, to your relatives. Not that I want to have very high views in the YouTube, but I think this will be helpful coming from a medical point of view, coming from a researched understanding, and a gentle encouragement to people. I think it would be a very useful video to forward. Thank you.
Thank you very much, Dr. Sunil, for such an insightful and thought-provoking session. Especially the insights that you brought about the realities of smoking, alcohol, substance abuse, and interesting 12 steps from the Alcoholics Anonymous. Thanks a lot for all the information that you shared with us today. As we start our time for question and answers, please feel free to send in any final questions that you would have through the chat. I have also posted a link to our YouTube channel where we have shared similar sessions, videos on similar sessions that we have conducted as JJSS before. Please do visit our channel. Please also join our WhatsApp channel to stay aware of the sessions that we organize. Okay, I take the first question. Not everyone who encounters smoking, alcohol, or drugs develops an addiction. From a medical perspective, what usually happens beneath the surface that causes some individuals to become dependent while others do not?
Well, are there genetic factors as to who is more predisposed to dependence or not? None of those has been found out. See, as I told you, and I gave you data regarding weed, for daily weed users, around 50% chance is there that they would get addicted. Why the other 50 are not getting addicted? I don't know. All I can say is there is a possibility of addiction. So the people who say that they can maybe risk the thing, you see, so I won't get addicted. Well, addiction is not the only problem of smoking, isn't it? Problem of smoking is the health effects of smoking, you see. So a person who is not addicted but who keeps smoking, they have the problem of smoking. The person who is not addicted to weed but who keeps taking weed, they may not be addicted in the sense they can stop it in October and then they can restart it in March. Fine. So they are not addicted. But what about that weed which has been taken? The harmful health effects of that, you see. And even alcohol also, same thing. So addiction is one of the problems. And to your question, is there any underlying some factors why some people get addicted and why some people don't get addicted? I don't think that there is this particular group of people who have been found who won't get addicted. I think it's just it's like, let me tell you something like this. If I say, drive carefully, otherwise you might have accident. Okay? This is a statement. So some of you will say, well, there are people who don't drive well and they don't have accident. Yeah, that is true. They are careless. And they are not having, why they are not having accident? Maybe they are very sharp or whatever, you know. But there is a very high risk. And you only need to have accident once, you see. So
Thank you.
my question, so therefore is, it's not worth the risk.
True. Thanks. I believe this question was already addressed in part during the session, but I would like to also raise that. Young people are naturally curious and are often exposed to influences from friends, social media, and their environment. While many may encounter opportunities to try smoking or drugs or alcohol, what factors would make some individuals vulnerable to developing harmful habits or addictions? I think Doctor mentioned about their
Yes.
environment factors already.
Exactly. See, what factors would, see, one of the main factors which affect all of this is the upbringing. Whether they had a stable family, their parenting, their parents were present with them, there was a happy family, or whether the father himself was an alcoholic, or father himself was an abusive father. You know, all kinds of things can happen. Or there was domestic violence and all of those. So people who come from broken families, they have higher chance. Second is the company. You see, the young person is in company with what kind of friends? If most of their friends are into some of these habits, naturally they will be drawn into some of these habits. And third is, I would say, the whole problem may not be with them only. There is an active group of people who are doing business. And drugs and all is big business, big money. You see, there is a drug cartels, and that's why in Punjab and all at one time the drug abuse was so high in Northeast. Why the problem is so much in Northeast? From Myanmar and other places, drugs comes in. And then they get into it, and then so there are these problems also. So there are small shops near the colleges, which are, if you look from outside, it's like a small shop, but many of these things are happening there. So it's big money. So I would say many youngsters are even lured into some of these things. And then the whole thing about identity, when people want to show that I am a hep guy, you know, and I try out all of this, you know. And especially among some people, they want to show that, well, I can have this much and still I can be sober, you know. All kinds of things can go into this. And finally, I would like to say a sense of purpose. in life. People who are pretty focused in their lives, for example, they're focused in studies, or they're focused in sports, or they want to achieve something. Many of these things are going to interfere with that. So they won't get into this. You see, people who are not really having much focus in their lives can easily be drawn into some of these things.
Thank you, Doctor. I think you already partly answered the next question I was about to raise. Let me put it. Beyond the health risk, what is the strongest reason for a person to avoid or get rid of smoking, alcohol, and substance abuse? What do they stand by staying away from these habits?
Yes, especially with respect to alcohol, I spoke in detail about the non-health issues, because, as a doctor, we are always talking about the physical health. But, even the WHO recommends, defines health as not just absence of disease, but state of emotional, mental, and spiritual well-being, you see. So, smoking, first of all, let's start with smoking. Now, a person smokes. He is causing trouble to himself. He is causing trouble to others also around him. You see, because he is smoking. So there is so many people have problems because of passive smoking. So now there are smoker zones are there. So people will go there and smoke. You see, okay. The other thing is weed and other things. I told it's a slippery slope. You never know where that person will go. Now, that person's purpose in life, you see, why that person is living. Of course, see, let me tell you something interesting. It is not that we all don't want pleasure in life. I sometimes think, why do I drink a chai? Why? When I get up in the morning or after some time, why do some of us have a coffee or tea? Is it essential for life? Not at all. It gives us some kind of a good feeling, isn't it? So it's not that we are not doing anything. Even why do we just eat some tasty food? So as human beings, I think we all want some kind of pleasure in life. But we have to draw a line. When having pleasure is going to inhibit or our walk in life, or it is going to have a negative effect on our productivity, negative effect on our purpose of living in this world, negative effect of our role in our society, then it is a bad thing, and we cannot and we should not get involved in that. So me having chai, therefore, doesn't come into that category. You see, that is why I think we can have chai. Again, somebody who is having 10 chais a day, that he's causing trouble to himself. And, so there is a line. And we have to draw lines. I don't think we should draw a line for others, but people have to draw a line for themselves. So it is going to affect their overall reason for even their living in this. A person who is who's become an alcohol addict, or a typical thing is of a drug addict, that person is just there. He's just existing, he or she. And it's so sad to see them, And they become poor, they're sent off from their jobs, and there's nobody, and they're lonely, and then mental health issues, and all kinds of things. So there are so many reasons why a person should not go into any of these things.
Thank you, Doctor, once again. As we come to the end of today's session, thank you all for joining us and for being part of this important conversation. We believe topics like smoking, alcohol, and substance abuse can often be difficult to discuss, but awareness and open dialogue are the essential first steps towards prevention, support, and recovery. On behalf of Jeevan Jala Sewa Samiti, thank you once again to Dr. Sunil for sharing his time, expertise, and experience with us. We also look forward to welcoming you to our upcoming JJSS sessions and community initiatives. Until then, Stay informed, stay connected, and take care of yourselves and those around you. Have a wonderful day. Thank you and goodbye.